So how should you prepare your body when you're trying to conceive? I'm Dr. Sharon Moyeri, owner and founder of OC Fertility. So a lot of people don't think to talk to their OBGYN or fertility specialist before they try to conceive, but it's a good idea to consider so that you make sure that you have everything ahead of time. You want to make sure that you have some blood tests to make sure that you're not anemic, that you have immunizations up to date, that your vitamin levels are okay, that your thyroid function is normalized. These are things that you can talk about at your well woman visit or make a special appointment with your OBGYN or your fertility specialist. Generally speaking, most pregnancies are unplanned and unintentional, so once you remove contraception, you should get pregnant pretty quickly. Typically, people get pregnant within the first 3 to 6 months that they remove any form of contraception, whether it's birth control pills, condoms, or even pull-out method. So you shouldn't necessarily wait too long before seeking attention. It's not important to have to do fertility tests right off the bat, but I would certainly consider it if you haven't gotten pregnant within 6 months. Before even trying to get pregnant, you want to make sure that you're on a quality prenatal vitamin that has the sufficient amount of folic acid. It's advisable to use a prescription grade so that you ensure you're having everything needed in that prenatal vitamin. You also want to make sure that you cut out things like alcohol, any form of tobacco and marijuana products, including vaping. Some people think vaping is safer than cigarette smoking, and in fact it's not. You also want to make sure that you're eating a well-balanced diet. Exercise is certainly a good idea, but you want to keep it moderate. You also want to make sure that you're timing your cycles so that you can monitor them and ensure that there's nothing going on with your cycles that might indicate that there's a problem. So keep track of them because it can be an important vital sign that there could be an issue. In addition to using ovulation predictor kits, you might want to consider monitoring with an Oura ring or even an app. These are things that a lot of people are starting to use. They might make you feel more empowered, but they're not necessary. Depending on how many kids you want to have, you may not want to wait the full year before you seek attention if you're younger than 35. So if you're starting your family at an older age and you want multiple children, it probably makes sense to start doing some further testing or talking to your doctors if you're not getting pregnant after 3 to 6 months. It might be a good idea to consider doing preconception counseling to do some genetic screening that might discover that you have some risk factors that you didn't know about, and that might lead you to do treatment to avoid those risk factors instead of trying to conceive naturally. As you're trying to conceive, it might be nice to talk to your family to understand their reproductive risk history. These are things that some people aren't necessarily comfortable sharing, but if they are, it might help you identify some potential risks in your own reproductive history. Lifestyle is really important when you're trying to conceive, so you want to make sure that you're eating a well-balanced meal. I usually advocate a Mediterranean type diet, whole foods, plant-based, minimally packaged, minimally processed foods. Certainly animal proteins are okay if that's something that you already are consuming, but you want to keep it clean and lean. Last but not least, you want to make sure that you're eliminating alcohol or at least limiting it while you're trying to conceive. You want to reduce caffeine while you're trying to conceive. You want to make sure that you're doing an exercise regimen that you can maintain during pregnancy.